All right, thank you very much. This is Dr. Ntlagani Pokumere. And again, let me introduce the topic for the next coming weekend. We will be talking about healthcare managers, in particular, the role that they must play in our healthcare facilities. We know that our clinics, our CHCs, that is community health centers, our district hospitals, regional hospitals, tertiary, and central hospitals around in the country are run by a series of managers that are meant to oversee the running of the hospital. And obviously, there may be variation of who the managers are. And but the classic example of what we call the executive management in a particular hospital constitutes a number of people, and those people are the CEO, who is the chief executive officer, who is the custodian, and also the person that is accountable for everything that happens in the hospital. After that, we have a person called a medical manager, or rather, many hospitals, that is regional hospitals, now use the term senior medical manager to define this person. And this person is in charge of all the medical services that are provided. And that is not exclusive of a allied health, where we talk about physiotherapists, as well as what I call OT, occupational therapy, audiology, and speech therapy, and dental health, as well as maybe psychology and the rest. So those are all forming part, and they fall under the senior medical management in terms of the cluster. Then you have other clusters that are making sure that the hospital actually functions, because in the hospital you have to employ people, you have to discharge people, there's labor relations, there's all of those issues. And the top managers that we have is, for instance, the assistant director human resources, who's then responsible for all the other clusters that are practices, as well as labor relations, as well as other issues that we have in there. And then you have a biggest office, assistant director, finance management, the person responsible for using appropriately their allocated budget, and also to help other managers to be able to know how to use that money without actually contravening the PFMA laws. And then we will have another person that is a systems manager. This is the person that I personally call the person in charge of the hospital. This is the person that from the beginning, when you enter the gate, this is the person that is responsible for the security of the facility. This is the person responsible for all the systems, in particular when it deals with maintenance, infrastructure, whether it deals with things that have been broken and that needs to be fixed, things that deal with almost everything, the accommodation, and all the rest. And this is the type of a person that I, for instance, will then say this is the person that is actually in charge of the hospital. Then we have a person that is called a nursing manager, rather an assistant director, nursing management, who is then responsible for all the nursing care in the facility, that is in charge of all the nurses in the hospital, including the clinics. And that person is also responsible for making sure that all the nurses actually adhere to the protocols and the guidelines that are stipulated to make sure that we follow. Then the next person that I need not to leave behind as we talk about all of these managers is actually an M&E, monitoring and evaluation person. You know that as people work in the facility, they actually develop and generate data, that is the information. You talk about the head count. You talk about the number of people that present in the emergency department. You talk about the number of people that presented with COVID-19 and all those type of things. That is the person with the actual information when it comes to the numbers and what we've done in the facility, and then is responsible to actually help the facility understand what is actually going on, whether are we meeting the target or we're not, and what might be the challenges thereof. This is the person that will be helping in terms of the strategic planning of the hospital and how it's run. Then after that, you have a person that is called a PRO. This is a public relations officer. That is the person esimbiza ngomkhumanisi in isiZulu, and this person is responsible for establishing communication between what I will call the community or community members with the facility, to ensure that whatever the facility is doing is actually in line with the needs of the community. But also, if communities have got any issues, they can easily access the management through the PRO, who will be then responsible to make sure that there is that good communication. And if anything changes that will affect the community, that information needs to go out to the community, because the community needs to know about it. For instance, all the healthcare the facilities are actually healthcare facilities that belong to what I will call to the community. Therefore, all of those managers, if I'm leaving anyone behind, please forgive me for that. But when I'm looking at all of these things, to me, what actually comes into my mind is a sense that, are we really doing what we can to provide the service the way that it's supposed to be provided? We know that there's been a lot of incidents of patient safety incidents in our country and in our facilities, and there are a lot of questions from the community. I mean, how much of this can we change as healthcare workers? And this really brings, for me, the question of, are healthcare workers themselves motivated to actually function in our facility? Do we as managers actually allow them to be able to use their 100% skill towards providing the care for our people? Are we strict in terms of accepting innovative ideas? Are we rigid in any sense? Is this really contributing into people not developing an interest and really love for health sciences and how we provide healthcare to our people? So today, or rather in the next few days, I will be calling in a doctor who is a mentor, who has been working in healthcare facility for a number of years. I was well known by the community in Mseleni and the surrounding, as well as in Bazwana, Imanguzi, everywhere where he goes. He's been working there for a number of years, providing the service the best way he knows how. This is what I call the true family physician doctor, who does operation at the level of the district hospital, and who does almost anything. He can, give you an injection today as a nurse, and tomorrow he's operating on your hip. And ladies and gentlemen, that will be Dr. Fredlund, who was the previous medical manager for Mseleni Hospital. So join us as we discuss this important topic. And if you have any comments, comment down below, and subscribe to our podcast channel to hear more about what we have to offer. Thank you.